The fetus can also hear noises from the world outside, conversations, loud noises, and music. The walls of the womb, together with the abdomen, act as a filter to most of the high frequencies. All sounds will reach the fetus distorted, but higher sounds will be more muffled. Only the lower bass notes of a piece of music will have much impact. Voices will sound distorted too. Vowels are generally lower in pitch than consonants, so the fetus will just hear the melody of speech without the percussion of consonants.
What, really screaming? That's not like her at all.
The sound of the mother's voice is different from any other, since it travels directly through the fluids of the body.
Oh.
This may help the baby develop the very different kind of relationship it has with its mother from anyone else.
Excellent. Good luck. See you later. Bye.
Hey, Clara, give us a hand.
Other voices, like the father's, must pass through air, then fluid, and may not cut through the general background noise.
See a little face there?
The loudest sound a fetus will ever hear may come during an ultrasound scan. It's impossible to hear the actual ultrasound waves. They're at far too high a frequency to affect the human ear. But the ultrasound could cause secondary waves in the amniotic fluid that the baby can hear. To produce finely detailed images, ultrasound probes fire a rapid succession of pulses, each lasting less than 1/1,000,000th of a second. The rapid switching on and off of these pulses can cause waves in the fluid, which would sound like a high-pitched tapping sound. If the probe were pointed directly at the baby's ear, it could sound as loud as a subway train. In normal circumstances, there is no need for the scanning probe to go anywhere near the ear. But if for any reason the baby was at all unhappy, she could easily wriggle away from the sound. Doctors have observed fetuses grimace and frown, just like in this 4D scan, as they manipulate the fetus through the mother's abdomen. Along with the expansion of the senses comes the development of pain. During the final trimester, the fetus must prepare for life outside the womb, away from her comforting cocoon and its built-in life support. Many of the crucial tricks and skills she will need to survive on the outside are innate reflexes that she will develop in the womb. From the 26th week, babies spend about 90% of their time asleep. And when they sleep, nothing will wake them. For the other 10% of the time, they are awake and alert, ready for whatever might happen next. They may react to sudden sounds with the startle reflex, flinging arms and legs out to the side. The startle reflex is thought to have originated at a time when we were more at risk of being eaten. A sudden noise or touch from a predator will trigger the reflex and cause the arms to fling out to the side in what may be an attempt at self-preservation. This may not be so relevant to our lives today, but other reflexes are crucial to survival after birth. In this 4D image, the fetus is swallowing amniotic fluid, and during this trimester, she will swallow up to ½ a litre of fluid every day. By swallowing amniotic fluid, the fetus helps maintain the fluid balance in the womb. It also helps her digestive system develop properly. But from the moment she is born and the cord is cut, she will need to have perfected the art of taking food from her mouth to her stomach. Alongside swallowing, one of the most important reflexes to have perfected before birth is sucking. Anything vaguely nipple-sized that comes close to her mouth will trigger her attempts at the sucking reflex. This fetus, aged 25 weeks, first sucked its thumb at about 11 weeks, at which time it may already have begun to develop a lifelong preference for one hand or the other. Ultrasound scans have shown that as soon as thumb sucking begins, a fetus tends to show a clear preference for either the left or right thumb. This left or right-handedness will stay with it for life, something previously thought to kick in only when a child is 3 or 4 years old. At 26 weeks, the fetus measures 25 centimetres from head to bottom. She's growing fast, and as she moves through the 3rd trimester towards birth, the fetus will triple her weight and double her length. There will continue to be dramatic growth in the brain and nervous system, and the fetus will create her first memory. By week 26, it may just be possible to hear the fetal heartbeat by putting your ear against the mother's abdomen.
Is she kicking?
It's quite loud.
The fetus's heart beats about twice as fast as her mother's. Monitoring the baby's heartbeat gives a good indication of her general condition.
Yeah. It's more of a vibration, really. You feel it moving as well. I'm feeling.
The mother's heart rate and blood pressure are directly affected by her emotional state. If she's calm, her heart will slow down and her blood pressure will drop. If she's tense and stressed, her heart will beat faster and her blood pressure will rise. Although the fetus has her own separate blood supply, these increases in heart rate and blood pressure are easily passed through the placenta and have a direct impact on the baby. It takes a while for the effects to filter through, but when the mother is recovering from the impact of stress and her heart rate is returning to normal, her baby's heart begins to race as the physiological effects of stress creep through the placenta. In the short term, stress in the mother can lead to low birth weight or premature birth. But it's also possible that a mother's prolonged anxiety and stress can be passed on, establishing a tendency for stress in the child and making her more likely to develop chronic health problems, heart disease, diabetes as an adult. It can even have a harmful effect on the child's mental development in the early years of her life. By now, the mother will be feeling her baby move every day. Usually this will be the fetus kicking or pushing, but sometimes she may feel the regular twitch of her baby's hiccups. Hiccups are an involuntary, sudden contraction of the diaphragm. Why fetuses hiccup is a bit of a mystery. One theory says it's a reflex that may help a baby latch onto a nipple and feed. The spasm of a fetus's hiccup is strong enough to feel, but unlike our own hiccups, it makes no sound at all. The sound of an adult hiccup is made by the sudden rush of air that is stopped by the closure of our vocal cords. But of course, in the fetus's lungs, there is no air, and so no hiccup sound. The last of the major organs to form are the lungs. The lungs don't function during the time in the womb. All the fetus's oxygen is delivered from the mother's blood via the placenta. Inside the fetus's lungs, the branching network of tubes is filled with amniotic fluid during the entire time in the womb, and the tiny air sacs that will extract oxygen from the air remain closed. But the fetus still makes breathing movements with her lungs and diaphragm. This helps the chest muscles practice, ready to expand and fill the lungs with air the moment the baby is born. Most fetuses that reach 26 weeks will make it through to birth with no further problem, putting on weight, exercising reflexes, as well as their new senses. But sometimes, things do go wrong. This 26-week-old fetus has developed a hole in his diaphragm, the membrane separating the lungs from the abdomen.
Baby's facing the completely wrong position.
It's not a problem now, but it means his intestines will grow into the lung cavity. This will stop the lungs developing properly, and when he is born, the baby will almost certainly be unable to breathe and will die. Professor Kypros Nicolaides is a world-renowned pioneer of fetal surgery at King's College Hospital in London. He has developed a technique to block the windpipe of the fetus with an inflatable bladder. This forces the intestines back where they belong and allows the lungs to develop properly. The procedure is done with keyhole surgery, using a fetoscope to operate on the baby inside the womb. A fetoscope is a long, narrow tube filled with fibre optic filaments. Light travels down one set of fibres to illuminate inside the uterus and is passed back out to a camera so the surgeon can see what he's doing. It also carries the delicate instruments to conduct the operation. The first step is to inject an anaesthetic into the fetus to stop it moving. The mother is awake during the entire procedure, with only a local anaesthetic to numb her. A general anaesthetic would be too harmful for the baby. Professor Nicolaides then inserts the fetoscope through an incision in the mother's abdomen into the amniotic cavity. Once he has safely reached the fetus, he gently pushes the fetoscope into the mouth and down the back of the throat.
So, yeah?
Yeah.
There. And then we discover there. So that is the epiglottis on the right.
Once inside the trachea, he inflates a tiny balloon that traps fluid inside the lungs. As the fetus grows, the lungs produce more fluid, which stimulates the lung tissue to grow and expand, forcing the intestines out of the chest cavity. The balloon is left in place for 2 months to give the lungs time to mature. The procedure is then repeated, and the balloon is removed in time for what everyone hopes will be a normal birth. Since this operation to treat babies with this defect has been available, it has increased their chance of survival by 50%. At 28 weeks, the baby is over 2/3 of the way through her time in the womb and is gaining weight fast as she lays down a layer of fat under her skin. Her senses are buzzing, and her cerebral cortex has matured enough to support consciousness. Over the next 4 weeks, her nervous system will become as advanced as a newborn baby's. She is becoming aware of the world around her, and for the first time, her brain is beginning to create memory.
What, really screaming?
The fetus will have spent so much time listening to her mother's voice, she will have become familiar with its rhythms.
Go into a mother and toddler group.
With this constant exposure, she will absorb enough of these patterns to recognize and even respond to her mother's voice.
Oh. No, I thought she was, though.
Researchers analyzing the cries of newborns found they already contained some of the rhythms and patterns of their mother's speech.
Yeah, you'd be fine.
The fetus can now hear, taste, smell, and touch. She is likely to have turned head down in the womb. She is getting ready for birth. For the mother, this change could be marked by some painful kicks straight in the ribs.
In the back of my mind is a feeling I'm going very slightly blind, but in the front.
The type of music a baby is exposed to can alter her mood. Fast music will stimulate and excite her. Music that is closest to the natural sounds and rhythms of the human voice, such as classical or choral music, will have a sedating, calming effect. If she hears the same music over and over again, she may even be able to remember it. At 33 weeks, the fetus may recognize a particular piece of music and can even jump in time to it. In one study, babies were repeatedly exposed to a particular TV soap opera theme during pregnancy. After birth, when the same music was played to them, these babies became alert, relaxed, and would stop crying. Babies that had not been exposed to the music in the womb would show no reaction at all to the same piece of music. For the researchers conducting the experiment, this was evidence of long-term memory at work before the baby is born.
Hey diddle diddle, the cat and the fiddle, the cow jumped over the moon. The little dog laughed, diddle diddle, the cat and the dish ran away with the spoon. Hey diddle diddle, the cat and the fiddle, the cow jumped over the moon. The cow jumped over the little dog laughed to see.
In a similar experiment, mothers would repeat a children's rhyme each day during the final month.
The cow jumped over the dish ran away with the spoon. The little dog laughed to see such fun. The cow jumped over the moon. Hey diddle diddle.
At the end of the experiment, a recurrent decrease in fetal heart rate showed that the fetus had become familiar with this particular rhyme, as opposed to similar rhymes they had not heard.
The cow jumped over the moon.
Some scientists argue that there is very little difference between the brain of a newborn baby and that of a 32-week-old fetus.
The cow jumped over.
Where once it seemed that the mental development of a baby began at birth, now it appears birth could be a relatively insignificant event in developmental terms. She may have to support herself after birth, but as for the process of thinking, learning, and remembering, she will already have been hard at work for 3 months, and her brain will continue to grow at the same rate for the next year.
That's what little boys are made of.
The final phase of pregnancy is a demanding one for the mother. Many women feel uncomfortable during the last couple of months. The weight of the baby, together with pressure on the spine and a battle for space, can all cause back and legs to ache. She may be feeling anxious about the birth and is likely to feel breathless as her lungs struggle to absorb 20% more oxygen than normal. One of the things revealed by the 4D scans is the fact that babies have REM, rapid eye movement sleep, a period of sleep where the eyes flick around behind the eyelids. Later in life, we know this is an indication of dreaming. This gentle flicker of an eye could be a sign that the fetus, still with a month to go before even being born, is already dreaming. Though with such little life experience, it's hard to imagine what they dream about, playing with their feet perhaps, or the gurgling of their mother's stomach. But why? In adulthood, dreaming plays a vital role in allowing us to make sense of events around us and develop strategies to deal with the world. In a fetus, dreaming, however simple the dreams, may be the crucial process that stimulates the brain to grow and develop. Sleep deprivation in a fetus or a newborn baby can seriously impair brain development. In just over 8 months, the brain has grown approximately 100 billion neurons, with 100 trillion connections. The brain and head have grown as big as they can in the womb and still be able to squeeze through the mother's pelvis. The fetus could quite happily survive if born any time from about 35 weeks, even without much medical help, although the longer she stays inside, the healthier she will be at birth. The mother is likely to be getting increasingly uncomfortable. Having begun as a single cell, the baby is now cramped and heavy. She is also a considerable drain on her mother, and in putting on fat is taking more resources than the mother can provide. It's time to emerge. The countdown is on. It's impossible to tell when the baby will be born exactly. Only 5% of babies are born on their due date. The rest can emerge any time 2 weeks either side of that. The mother is kept guessing and waiting for signs. The first contraction of the uterus, or the breaking waters as the amniotic sac ruptures.